by these people, you people. So I'm Dr. Prahalad from Mysore. Today I'm going to highlight on the how to take care of kidney in diabetes. As you all know, diabetes is a metabolic disorder and it is also a progressive disorder. So we only need to control the diabetes to avoid the injury to the kidneys. With this, I'll share some slides. Is it visible? Can
No,
you see
doctor.
the?
Still, no. Still, it's not came.
Uh, Doctor, you can try once. No, doctor, you will be able to share the screen.
Share option is not there. It is not highlighted.
On the green mark, arrow mark is there, no, doctor. If you permit, I can share.
Yeah, you can do that.
Vishnu ಅವರೇ ನನ್ನನ್ನು co-host ಮಾಡ್ತೀರಾ? I can share the slides.
Yes, Satish, you are the co-host now. Okay.
Yeah. Today's topic is diabetic kidney disease. As I already told, diabetes is a progressive and metabolic disorder. It is common in India, and India is called diabetic capital of the world. And most of the people they are diagnosed are not under control. At least only 20% of the diabetes are under control. And if they are under control, they can prevent the or end organ damage like heart, kidney, retina, like that. So diabetes control is a must. So before going to the diabetes and kidney disease, I will tell a little bit about the anatomy and physiology of the kidneys. As you all know, kidney is very important organ which filters the toxic product situated in the on either side of the vertebral column, and there are many millions of units. It is called glomeruli. It has got afferent and efferent vessels. Whenever the blood enters through the afferent vessels, the glomeruli filters the excess of toxic products from the blood, and it will be excreted. Whenever there is reduced blood supply, like the narrowing of the afferent vessels, the kidney fails to filter the toxic products. So the urea and creatinine level it increases. So the narrowing of the afferent vessels is caused by uncontrolled diabetes, uncontrolled hypertension. Failing kidney lose their ability to filter out waste products, resulting in kidney disease and kidney failure in the long run. Next slide. Next slide. So, what are all the common symptoms of kidney disease? Usually, normally the creatinine should be below 1.2, and if it goes above, the water retention will be there in the body because of the afferent vessel narrowing. So it causes swelling of the hands and the face, and sometimes even the whole body. There will be difficulty in breathing also, and appetite will be suppressed. There will be a lot of disturbance in the sleep, and they may feel weakness, nausea, vomiting, like that. And there will be a lot of muscle wasting and muscle twitchings also there. So, because of this high creatinine level, the viscosity of the blood increases, and it may cause blood clot anywhere in the body, including the heart, peripheral vessels, and the brain. It may cause abnormality of the heart beating also. Next slide. So what are all the regular diagnostic tests? So first and foremost is you have to assess the diabetes, whether it is under control or not, by doing fasting blood sugar, postprandial blood sugar, and HbA1c. HbA1c, it is done once in 3 months. It gives an average blood sugar level, and normally the HbA1c should be within 5.8%. If it is below 5.8%, it is non-diabetic, and it is in between 5.8 and 6.4, it is called pre-diabetic, and above 6.4, it requires pharmacological treatment. So in pre-diabetic condition, sometimes we prescribe only metformin and lifestyle modification, and above that, they have to take the medicine regularly. And one has to get checked regularly once in 3 months, and so that we can monitor and titrate the dosage of the oral hypoglycemic agents. If you do not follow the regular follow-up, it may end up with there are so many complications like retinopathy, nephropathy, neuropathy, like that. So second thing is to assess the other functions of the renal capability. We have to do blood urea, creatinine, and lipid profile is also equally important, and uric acid level, serum electrolytes. Many a times the sodium level goes down and potassium increases. There are a lot of problem arises. And to know the filtration condition, you have to do EGFR, that is glomerular filtration rate. And if you want to know the kidney function in the early stages itself, you have to do urine microalbumin. So that is, they are passing a little bit of protein in the urine that can be measured by urine microalbumin. So these are all the preliminary tests to be done. And the presence of protein in the urine, as I already told. And next thing is imaging. Usually the ultrasound and MRI and CT scanning is done, but CT scan is not allowed when the creatinine level is very high. So other imaging test may be used, and when it is required, renal biopsy is also advisable. Next. So what are the precautions you have to take? So the first of foremost is the diet. Diet in the diabetes to avoid the kidney disease. Both hypertensive diet and diabetic diet should be followed. They have to cut down completely the carbohydrate like sugar and jaggery. They should not take as much as possible. They have to reduce the carbohydrate intake like rice, wheat, and ragi. Better consume lot of cereals and pulses and nuts, and even dairy product is advisable. Uh, and even high fat diet is also advisable before the kidney disease. And salt restriction is also available. Usually the salt requirement for a normal human being is 2 to 3 grams per day. They should not take excess of salt, processed food, bottled food, like that. And regular exercise and walking. Walking is more than enough. At least 40 minutes per day is advisable. And if there is any habits of drinking and smoking, they have to quit it. And if they are obese, they have to reduce the body weight by doing regular exercise and diet. Next. So the management of diabetic kidney disease is a big chapter. So one first and foremost is we have to control the hypertension as well as the blood sugar by regular monitoring and regular titrating the oral hypoglycemic agents as well as oral hypertensive drugs. So that good control, it can prevent, at least they can delay the kidney dysfunction and other complication. So usually I have already told our aim is to reduce the HbA1c at least by 7%. For that, we have to choose appropriate medicine, and that will be decided by your doctor. And regarding the blood pressure also, one should reduce at least 180. Normally, it should be less than 120 by 80. At least it should be 140 by 90 millimeter, so that we can prevent end organ damage, particularly the nephropathy, kidney problems. And the medicine, according to that, ARB, AC inhibitor, there are so many other drugs that will be chosen by your doctor. And proper control of the LDL, that is the cholesterol lowering drug, should be used. Statins, which reduce, normally the LDL level should be less than 100, and those who are comorbid, that is those who are having hypertension and diabetes, it should be less than 70 ideal. And there are actually most of the hypertensive and diabetic patients, they are deficient in calcium and vitamin D, that should be supplemented according to the blood level. And to control the protein in the urine, medication, there are so many medication to reduce, and they have to reduce the intake of protein, etc. And again, to control the protein, they have to control the blood pressure as well as diabetes. Next. In summary, as I already told, I can say in simple words: walking first, diet next, regular checkup must, and you will be best. So consult your doctor regularly and strictly adhere to the doctor's advice on diet, exercise, and medication. Don't stop the medicine by your own unless your doctor advises. Maintain your normal routine, like a good sleep of 8 hours, work for 8 hours, and remaining 8 hours for your physical activities, family activities, and other things. So connect with other people, with those who have diabetes and kidney disease, to manage the disease better. And think good, actually, always. So in another words, I can say, eat less, walk more, live, you can live long. Thank you. I think you are muted, Satish.
Yes, doctor. Thank you, doctor. Thank you for educating the patients regarding diabetes and kidney stress. So, anybody want to ask any questions regarding this? If anybody want to ask, they can unmute and ask the questions.
Okay.
I think nobody is asking, doctor.
And if there are no questions, that means
Okay.
everybody has understood or completely not followed.
No, not like that. I think most of all they are every day they are listening, and they are, when they are coming for the consultation, they will heard regarding this.
Yes, yes. That's what I told. Everybody knows the subject, or otherwise they didn't follow that. Okay.
So nobody is asking, doctor. So I thank you very much, doctor, for because now morning is a busy schedule, because you want to go for the practice. Even that time you are giving a valuable time to us, so to educate the patients. So I thank you, Dr. Prahlad Rao, for giving such a good information to the patient and giving valuable time.
Thank you. Thank you very much.
Thank you, doctor.
Thank you.